You take a breath right now, and your lungs do something extraordinary. More than 300 million tiny air sacs, each one thinner than a strand of spider silk, expand gently, pull oxygen from the air, and push it directly into your bloodstream. It happens in less than a second. It happens 12 to 20 times every minute. It has been happening since the moment you were born. Your lungs are, without question, one of the most elegant and quietly powerful systems in the entire human body. Now imagine slowly, deliberately, systematically destroying them, not all at once, not in a dramatic cinematic collapse, but one cigarette at a time, one puff at a time, one invisible decision at a time. That is exactly what smoking does. And the truly terrifying part is how long it takes before you feel it. By the time your body sends you the first signal that something is seriously wrong, the damage has often been building for years, even decades. Silently, patiently, irreversibly. Let's talk about what actually happens. Not the warnings on the package. Not the vague statistic that smoking causes cancer. Let's go inside the lungs and watch, in real time, what a single cigarette actually does from the very first moment the smoke enters your airway. The instant smoke crosses your lips, it carries with it more than 7,000 chemical compounds. Hundreds of them are toxic. At least 70 are known carcinogens, substances that can directly trigger the mutation of healthy cells into cancer cells. Among those chemicals are formaldehyde, the same compound used to preserve corpses; arsenic, a poison used historically as a murder weapon; hydrogen cyanide, which was used in gas chambers; benzene, a petrochemical solvent; carbon monoxide, the same colorless gas that makes faulty heaters deadly; and nicotine, which threads all of this together by making sure you come back for more. This mixture of gases, particles, and compounds reaches your throat within seconds, and the body immediately mobilizes its first line of defense. Your airways are lined with something called the mucociliary escalator, a carpet of microscopic hair-like structures called cilia, all beating rhythmically upward, designed to trap and expel foreign particles before they reach the delicate tissue of the lungs themselves. In a healthy non-smoker, this system is remarkably efficient. Dust, pollen, bacteria, viruses. All of it gets caught in the mucus layer and swept upward to be swallowed or coughed out. Smoking paralyzes this system almost immediately. The chemicals in cigarette smoke slow the cilia, make them sluggish, uncoordinated, and eventually kill them outright. With the escalator broken, mucus accumulates. Particles that should have been expelled now settle deep into the airways. Bacteria that would normally have been cleared are allowed to colonize and multiply. This is why smokers develop that characteristic deep cough. The body is trying desperately to do mechanically what the cilia can no longer do automatically. That cough is not a minor inconvenience. It is an alarm bell, but the cilia are only the beginning. Deeper in the lungs, something far more sinister begins to unfold over time. The airways themselves begin to change. The lining of the bronchial tubes, normally smooth and clear, starts to thicken and swell with chronic inflammation. The muscles around the airways tighten. The tubes narrow. Breathing, which once required no effort at all, starts to demand more and more work. The air that used to move freely in and out now has to squeeze through passages that are progressively smaller, more congested, and more scarred. This is the beginning of what doctors call chronic obstructive pulmonary disease, or COPD, a condition that encompasses two related and often overlapping diseases: chronic bronchitis and emphysema. Both are caused primarily by smoking, both are progressive, and critically, both are irreversible. Once the damage accumulates to a significant degree, no medication, no surgery, no amount of quitting can fully restore what was lost. The goal of treatment shifts from healing to managing, trying to slow the decline rather than reverse it. Chronic bronchitis develops when the air passages in the lungs become chronically inflamed and the cells lining them begin to overproduce mucus. The cough becomes constant, the chest feels heavy. Every respiratory infection, every cold, every flu hits harder and lasts longer because the airways are already compromised and the immune defenses are already strained. People with chronic bronchitis often describe feeling like they are breathing through a wet cloth. Not occasionally, not on bad days, always. Emphysema is, if anything, even more insidious. Remember those 300 million air sacs, the alveoli, that make gas exchange possible? In emphysema, the walls between them are slowly destroyed. The tiny sacs merge into larger, floppier chambers that cannot expand and contract efficiently. The surface area available for gas exchange, which, in a healthy lung, would cover roughly the size of a tennis court, collapses inward. The lungs lose their elasticity, becoming stretched and unable to fully exhale. Air gets trapped. The chest becomes permanently overinflated. Patients develop a distinctive barrel-chested appearance as their rib cage remodels itself around lungs that can no longer deflate properly. Breathing in emphysema is exhausting in a way that is almost impossible to describe to someone who has never experienced it. Imagine sprinting hard for 30 seconds and then not being allowed to fully catch your breath, ever. Imagine feeling that low-level air hunger not during exercise, but while sitting still, while talking, while simply trying to eat a meal. In the late stages of emphysema, getting dressed in the morning can leave a person gasping. Walking from the bedroom to the bathroom can require rest stops. And then there is lung cancer. If COPD is the long, slow grinding of smoking's damage, lung cancer is its most deadly strike. The same chemicals that inflame and scar the lung tissue also cause mutations in the DNA of the cells lining the airways. Under normal circumstances, cells divide in an orderly, controlled way. Old cells are replaced. Worn tissue is renewed. But when DNA is repeatedly damaged by carcinogens, the instructions governing cell division become corrupted. Cells begin to multiply uncontrollably. Tumors form. Lung cancer is the leading cause of cancer death worldwide. It kills more people than breast cancer, prostate cancer, and colorectal cancer combined. And smoking is responsible for approximately 85% of all cases. What makes lung cancer particularly lethal, more so than many other cancers, is how late it tends to be detected. The lungs have no pain receptors in the tissue itself. Early-stage tumors cause no pain. They often cause no symptoms at all until they have grown large enough to obstruct airways, press on blood vessels, or spread to other organs. By the time most people are diagnosed, the disease is already in an advanced stage. The 5-year survival rate for late-stage lung cancer remains devastatingly low. But smoking's assault on the lungs does not stop with COPD and cancer. It also dramatically increases the risk of pneumonia and other respiratory infections. It weakens the immune response within the lungs, making it harder for the body to fight off bacteria and viruses that would be manageable in a healthy person. It increases the risk of tuberculosis. It causes pulmonary hypertension, a dangerous increase in blood pressure within the blood vessels of the lungs, which puts enormous strain on the right side of the heart and can lead to heart failure. There is also something that rarely gets discussed when we talk about the lungs and smoking: the loss of reserve capacity. Healthy lungs have a remarkable amount of redundancy built in. You can lose a significant portion of your lung function before you even notice it in daily life. This sounds like a good thing, but it is actually what makes smoking so deceptive and so dangerous, because the damage accumulates slowly and silently, for years or even decades. The person smoking genuinely feels fine. The lungs compensate, the body adapts, and so the habit continues, unchallenged by any obvious consequence, while the reserve capacity steadily erodes, until one day it is gone, and there is no more cushion left, and even ordinary activity becomes a struggle. The question that almost everyone asks at some point is, what happens if you quit? The answer is more complicated than a simple yes or no, and far more nuanced than most people expect. Within 20 minutes of your last cigarette, your heart rate drops, and your blood pressure begins to normalize. Within 12 hours, the carbon monoxide in your blood falls back to normal levels, and your blood can carry oxygen more efficiently. Within a few weeks, circulation improves, and lung function begins to recover. The cilia, if they haven't been completely destroyed, start to regrow and resume their cleaning function. Coughing may temporarily increase as the lungs begin clearing accumulated debris. Within a year, the risk of coronary heart disease drops by half compared to a smoker. Within 5 to 15 years, the stroke risk approaches that of a non-smoker. Within 10 years, the risk of dying from lung cancer falls to roughly half that of someone who continues smoking. But, and this is the part that deserves to be said clearly, the structural damage to lung tissue does not fully reverse. Alveoli destroyed by emphysema do not regenerate. Scar tissue laid down by years of inflammation does not dissolve. The lung function that was lost in those silent early years of disease is not recovered. Quitting stops the acceleration of the damage. It gives the remaining healthy tissue a chance to compensate and adapt. It dramatically reduces the risk of future disease, but it does not erase what has already been done. This is why the timing of quitting matters so profoundly. The earlier a person stops, the more of that precious reserve lung capacity remains intact, the more the body can repair the damage that is still reversible, and the longer the window of healthy, functional breathing that lies ahead. Every year of continued smoking is a year of loss that cannot be fully reclaimed. We tend to think of smoking's harm as something theoretical, something abstract, a statistical risk that might affect someone else, somewhere down the line. But inside the body of every person who smokes, the damage is not theoretical. It is happening right now. With every cigarette, chemicals are landing on the delicate tissue of the airways. Cilia are struggling and dying. Inflammatory signals are firing. Cells are mutating. The lungs that will need to carry a person through every year, every decade, every breath of their life are quietly, steadily, irreversibly being eroded.